Growing up, I was a pretty good kid. I don't ever remember getting into any sort of real trouble. So when I got to high school, my senior year, about to graduate, I figured if I was going to do anything even remotely questionable, this was the time to do it. I wasn't a party girl. I didn't go to typical high school parties, not because I didn't have friends, but because they just weren't my thing. So here I was, about to graduate, and I was invited to a party, and I said yes. So Saturday night, I get ready, and I was waiting for my friends to pick me up. And remember, this was the day before we had mobiles and cell phones. And I waited, and I waited, and they didn't come. No one ever called to let me know that the plans had changed or that they weren't coming. I don't remember exactly what the excuse was on Monday when we got back to school, but I do remember the feeling that being left there waiting felt like. And no excuse really could ever remove that feeling of exclusion, that feeling of being left out. A child with disabilities feels that sense of exclusion every day, and no society has yet got it just right. No matter how wealthy a country or how good the school or the healthcare system, disability is still a barrier. And if you're not lucky enough to be living in one of the wealthiest countries, life can be really tough. Studies carried out across Europe and the Middle East, but you might as well say studies carried out globally, demonstrate the challenges that people with disabilities face and how urgent it is that we address the problem. As an example, research by World Vision in Bosnia and Herzegovina revealed that children with disabilities are amongst the most marginalized and excluded groups. They are likely to be among the poorest members of the population and are less likely to attend school and less likely to have access to medical and social services. In Albania, joint research with World Vision and Save the Children shows that only 4% of children who have a disability have been given a medical card, recognizing their status and giving them access to the services they are entitled to. More than that, in a country that has historic problem with its healthcare system, half of all children have at least one type and degree of disability. Parents report that as many as 1 in 10 children have moderate or severe disabilities, especially if you take into account learning and emotional or behavioral problems. The statistics are alarming. We don't believe they are isolated, and they have huge implications for the provision of healthcare, education, and social services. The level of poverty amongst families who have children with disabilities is also striking. That 44% of families who participated in a study for World Vision in Georgia were formally, officially registered as poor, strongly supports the belief that disability in a household has a large correlation to poverty. Sadly, attitudes also fuel the exclusion of children with disabilities. They are more likely to be attacked if they go out, and some families feel there is a stigma to having a child with a disability and keep those children in the house, further marginalizing them. Romania is an example of the other side of the problem. Even if children can access the help they need, it turns out that the services often aren't very good. Either they aren't enough professional health or teaching staff, or their training isn't sufficient to meet the scale of the demand. World Vision's own Child Protection Index was developed with Child Pact, shows that while most of these countries have a commitment to address disability, most countries are far from having the services and capacity in place to fulfill it. Yet, World Vision is an organization that cares passionately about the most vulnerable children. So what do we do about all of this? In 2013, we started an extensive review of our programs that work with children with disabilities. Through that process, we started to see what worked and what didn't work, particularly in relationship to sustainability of these programs. About that time, we also saw 3 evaluations of World Vision programs in Romania, gave results that showed we were making a marked difference in the lives of children with disabilities. For example, studies showed that only about 20% of children with disabilities were in mainstream school in Romania. The evaluation of our work in Valcea found that number had gone up to 45% of children with disabilities being in mainstream school. 55% of the parents of children with disabilities who were interviewed said they thought their kids were integrated and participating in activities. 53% of parents considered that their kids were being treated the same as other children in the community, and 58% thought their children's rights were respected and protected. Similar results were reported in other 2 areas in which we were working. Now, I know these figures might not sound very impressive, but they are well above the average, and we wanted to know why. The evaluations were finished, so we couldn't, at that stage, do much more with the data. We did, however, conduct a case study to understand the evolution of programming for children with disabilities in Romania, to draw out and document the core framework that led to such significant results. In doing so, we were able to identify some fundamental approaches that had qualities we were looking for. Holistic approaches that work with children, families, communities, and the systems and structures around them, and that are sustainable. Well, first, it's important to say that no one group can go about this on their own. Building partnerships is the first step. The state services have to fulfill their role, even if they're not currently doing so. World Vision may start out in some of these projects as a service provider, but we are always planning, where possible, to turn ourselves into a facilitator. For the sake of sustainability, any long-term service should be run by the appropriate local body, either government or an NGO. Something I can't stress enough is the importance of involving the children and young people if you want to truly meet their needs. When World Vision Romania found that on some occasions parents didn't want their children appearing in public to speak or say what they wanted because they felt embarrassed or ashamed. So we made sure to incorporate different ways, say sign language or pictures, of making sure that all the children were able to communicate their needs. This is the second important area. Third, we found that alternative methods of care are absolutely critical, and these need to promote a holistic and empowering approach. When World Vision first started working with children with disabilities, it engaged in the institutions that, at the time, housed large numbers of children. As World Vision Romania's programming went through the process of review and adaptation, it pushed this circle of care approach. World Vision believes that a child is best cared for in and by her or his community, and with their families. This circle of care needs support, resources, and training to work well, but it also means that children don't end up in institutions. We worked hard to establish daycare and rehabilitation centers, and where we worked with the local authorities, we worked hard to cultivate mid-level contacts so that programs weren't derailed by changing higher-level political appointees. The circle of care includes outreach programs where expert mobile services visit the communities. It also includes early intervention, family support, inclusive education, and community-based centers. Where children with severe disabilities needed to remain in institutions, programming shifted to teach them life skills and to work with communities on issues of inclusion. Along the way, World Vision Romania also provided training to parents and teachers, helping them to establish peer-to-peer support and resource centers. Here's an example. Ella is the mother of twins who have autism. They were diagnosed at the age of 2, and her doctors advised her to give them over to a state orphanage. She refused, and with the support of her faith and her family, she decided to learn everything she could about her children's condition and their needs. One day, and we're proud to say with World Vision Romania's support, Ella decided to create a parents' association. It now helps other parents of children with disabilities from diagnosis through understanding their needs and learning to thriving as a family. Another example is Angelina. Angelina is 7 and she has Down syndrome. When she was born, her mother refused to take her home from the hospital as she was afraid what people in her community would say. However, Angelina's father insisted she was coming home with them, and that saved Angelina from being institutionalized in a home for children with disabilities. It took 3 years before Angelina's mother accepted her for the special girl that she is. And I'm pleased to say that with World Vision's support and guidance helped Angelina's mom through this difficult time. Angelina was also given speech therapy and physical therapy, and she is now in 1st grade in a regular school. Her mom is very proud of her and is now an activist on disability issues. The fact that Angelina is now in school is great news. Education remains absolutely crucial to a child's future prospects, whether they have a disability or not. We have worked hard with parents, teachers, and children on inclusive education, mentoring the school to include children with disabilities, and helping their parents establish peer-to-peer support. We have organized campaigns to raise awareness and continuing professional development programs for teachers for individualized teaching. World Vision Romania also realized that in addition to services, attitudes needed to change. So we also had to engage in local and national level advocacy. For too long, children with disabilities and their families have had to fight for the opportunities and services which are theirs by right. A cruel mix of discrimination, superstition, prejudice, and a refusal or inability to provide for special needs has left our children outside looking in. We have to do something about this. We have the tools to do something about this. And when we have truly inclusive communities in which children with disabilities are embraced, it is the community which is the biggest winner. I commend this sustainability framework to you. We need the results it can yield. If you want to know more about World Vision's framework for disability or any of the evidence for change work that we are doing, there's a website, wvevidenceforchange.org.